everybody. I am interviewing Sylvia Zannis, Dr. Sylvia Zannis, or Dr. Sylvia, as she likes to be called. And she is a dentist at the Biomed Center in Providence, Rhode Island. She's a biological dentist, and just a little something to give you some background about her. She received her DDS degree, Doctor of Dental Science, from the University of Michigan School of Dentistry. And then she got her advanced education in general dentistry at Boston University Henry Goldman School of Dentistry. And now she is pursuing her naturopath degree with the American College of Integrative Medicine and Dentistry, which is a really wonderful combination. She's settled into her private practice in Providence, Rhode Island, like I said, at the Biomed Center. And she began to explore the connection of mind, body, spirit, and a journey with her patients in search of the root causes to their symptoms. She discovered the paradigm shift of integrating dentistry and medicine, seeing the mouth as a gateway, and everything is connected, as I always say. So she's going to let us know about how your mouth is a window into your overall health. And we've met Dr. Sylvia through mutual patients. I've referred some patients to her, and she's referred some patients to me. And we finally got on the phone and actually met each other virtually, but to put a face to a name, and started talking. And I said, I have to have you on my podcast so that people can understand why I refer people to her. Like, what does the mouth have anything to do with the rest of your body, and especially your brain, specifically root causes of mental health issues, and more specifically depression. So you're going to learn about all of that today, and I hope you enjoy this episode. So Dr. Sylvia Zannis, welcome to my podcast on Lunch and Learn, Functional Mind.
Thank you so much for having me. I'm very excited to be here, especially, working with you. And excited to share the information we have.
Great. So tell us a little bit about you and how you became a biological dentist, more specifically a biological dentist rather than a conventional dentist. And what's the difference between those two types of dentistry?
Sure. So every accredited dentist goes through the same schooling in the US. So you typically do 4 years of dental school, and then you can choose to specialize after that. The route that I took, I went to 4 years of dental school. I did a 1-year residency after dental school, really to get more experience clinically, surgical and aesthetic treatments. And then after practicing for about 2 years, I was, introduced to this topic of biological dentistry, actually from a patient. So dentistry, people typically view dentists as a place that they go to get things fixed. So it's a very reactionary approach. I was seeing, 30 patients a day, just kind of, doing quick drill and fill.
Right.
That was the type of practice that I was in.
That's very similar. That's very similar to the conventional, traditional medical practices as well.
Exactly. So got patients in and out, fix their symptoms, and move on. And I, similarly, when I met this patient, I was going through this, God, am I really helping people? This is why I got into this profession. So I was having this, spiritual, struggle, making sure that I'm doing what I'm supposed to be doing. So I met this patient. She came into the office. The first time I met her, she had walked in with a walker. And she had introduced this topic of mercury fillings. She had mercury fillings on nearly every single tooth. And she said, I have brain fog, chronic fatigue, and my one goal is to dance at my son's wedding. And I'm using this walker. I know if I get this mercury fillings out, that I will feel better. So we did a biocompatibility materials test to see if she was in fact reacted to mercury, which she is.
Mhm.
And she had kind of taught me how to remove these fillings safely, to keep her safe, to keep myself safe, and the rest of the office staff. And this was my introduction. So long story short, by the end of it, I really followed her recommendations and discovered the IAOMT, and they are really the gold standard for safely removing mercury fillings, and many other things.
Yeah.
And
Can you just
them.
can you just tell the audience what the IAOMT stands for? And just it's a website where you can find a biological dentist in your area. But what do those letters stand for?
Exactly. So it's the International Academy of Medical and Toxicology. And it's a group of like-minded dentists and really any other practitioners that have, they want evidence-based research with no incentives. They care about getting to the root cause, protecting themselves and their patients.
Excellent.
Yeah, so they give great guidelines, a lot of great resources for patients as well. By the end of treatment with my patient, she was walking without a walker. She had felt better. This is one simple story, anecdotal maybe, but this had made the biggest impact on my life. And from that day on, I never placed another mercury filling. Or at that time, I didn't have everything that I could to remove them safely, so I stopped removing them. And then now I'm practicing the dentistry that I want to practice.
Great.
Again.
So
Yeah.
how many years ago did you have this experience with that patient?
That was 3 years ago.
Great. Yeah. And so now you are in a facility where you can take or remove mercury fillings safely?
Yes, exactly. So a lot of patients will come into our practice. Probably the biggest complaints that we get that are associated with mercury poisoning are chronic fatigue, brain fog, double vision, insomnia, depression, other autoimmune diseases, MS would be another one. So I love working with a functional doctor, to make sure it's safe for the patient to have these removed, because there's a lot more that goes into it than just the physical removal of these fillings. These fillings have been in the patient's mouth typically for many years. The vapor that they have inhaled binds to their tissues. So there is still a heavy body burden that needs to be addressed safely with the functional doctor as well.
Right. Right. Yeah. So tell us, what is the setup in your office in order to safely remove mercury? What do you have set up there and to keep you safe as well as the patient safe?
So this, the IAOMT, they have a really great checklist online. So we have that in the room, and I have the patient look at that beforehand. So basically, anybody in the room while I'm removing the fillings are covered from head to toe, draped, hair nets, everything. And the patient, the only thing that's exposed is the teeth that we're working on. They have a rubber dam, which is extremely important to protect the patient from swallowing any particles or vapor. We have a suction very close to their mouth during the procedure in our room, and it should be in an enclosed room. We have ionizers in our room that help filtrate the air. During the removal process, it's also very important that the mercury is removed in bigger pieces. So this cuts down on the vapor exposure in the room as well. We do rinses with before and after with some binders. Again, working with a functional doc is really important, and making sure that it's tolerable for the patient.
Right. So how many sessions do you need to be able to do that? Obviously,
Yes.
it depends on how many teeth are impacted, but like if you can give a sort of a a roundabout number of teeth in how many hours or how many sessions? Yeah.
Yeah, so it is tough to say because the amount of surfaces on the tooth that has mercury really determines how much time and the amount of teeth that there are. So for example, if you have 2 mercury fillings, average size fillings, it would be about an hour, hour and a half visit. We follow a couple of scheduling protocol when we are removing mercury fillings as well. We like to work in quadrants in the mouth if there are a lot of fillings. So for women, there's, a specific way, lower left, upper left, when we're removing them, we remove them based on the qi of the body in Chinese medicine. So this, and then also when we're scheduling, the immune system resets in every 7-day increments. So if a patient had mercury removal on a Monday, the next week we would do it on a Tuesday or a Wednesday because we wouldn't want to burden the body with that 7-day cycle. So it works in 7, 14, and 21 days. But patients don't have to worry about that. We take care of that for them.
That's great. That's great. Yeah. So, I'm trying to think if there's anything else that I do you do mercury testing at all before you start? Let's say they start with you and they don't have a functional medicine provider. Do you do all of the testing to see what their body burden is of mercury, et cetera?
Yeah. So there are a couple of different tests. I do like to work with a functional doctor when I'm doing these tests. There's a mercury test. So you can have your hair, urine, and blood analyzed, and they're going to give us, different kinds of mercury and the way the body is detoxing them. It can get, it can get a little confusing for patients too, if they're trying to do these things on their own. If a patient has a lot of mercury fillings and they got a hair test and it shows that no mercury is in the hair, well, we know that they are inhaling vapor every day, but maybe they're detoxing very poorly. So it's not coming out in the hair. Whereas like a blood test would be if there was, an event that would spike the mercury levels in the blood. So the test, it's great. It gives us a lot of, different, different ideas about how the way the patient's detoxing. Genetic testing is something else that I like to recommend to patients. The APOE gene or the MTHFR gene. This can tell us a lot about how the patient's detoxing and their body burden too.
Okay. Yeah, I like to get a compilation of genes and not just those 2 genes, and it's about the same price and actually less expensive if you use certain companies. They do the whole methylation cycle, and
That's working with a functional doc, so get the big picture.
Yeah. So, I know that there are other situations that impact the whole body besides mercury, like root canals, and we do get a history of root canals that a person might have had because it's important to know whether or not there were complications from that root canal, whether or not they have abscesses, and also cavitations. These are all things that can actually impact on the body on a long-term basis. Can you speak about those things?
Yeah, absolutely. So root canals are a great place to start. Every new patient that comes into the practice, we get a 3D scan. This is called a cone beam or a CBCT. So this is different than traditional x-rays at a dental office. Traditional x-rays give us a 2D image of your 3D teeth and jawbone. So this 3D scan allows us to see around every single tooth and the sinuses, the ligaments. This is incredibly important for anybody that has a root canal. We have diagnosed many, hidden asymptomatic infections that are present on the cone beam that we would have completely missed with traditional x-rays. So any patient that comes in with root canal concerns, this is the first place that I start.
Yes.
The idea behind
just so you know, that's one of the main reasons why I refer people to you, is to get that CT scan, the cone beam. It's extremely important. So when you guys came in, I was so excited, like, yay, I have a place to send people to get this specific CT scan. It's so powerful to have that knowledge.
Exactly. And, it gives us a lot of other information as well. So we start there with patients. And let's see what we're talking about. Root. Okay, so we start there. So the root canal system. The idea behind a root canal is to, you have a living tooth that has its own immunity, own vessels, and you take out the center of that tooth. You take out the nerve, the blood supply, and the tooth's ability to cleanse itself. And then the idea is to sterilize the tooth. So every single tooth has miles and miles of little channels running off that center canal. And it's impossible to sterilize a tooth. So
what were they thinking?
I mean, the idea, it is so devastating to have a tooth, extracted. It really is an emotional experience, especially depending on where it is in the mouth, especially if it's a front tooth, which a lot of patients come to us because they've had previous trauma. So many patients come in and say, I've had a root canal in this tooth since I was 10 years old. I fell off a bike or rollerblading. So this is, something that they have had to deal with for a long time. So we know that there's no such thing as a sterile root canal. You will always be harboring bacteria around the tooth. So the other huge thing about biological dentistry is that we take a very individualized approach. So, there is a spectrum in biological dentistry. Some would tell you 100% take out every single root canal, no matter what. We kind of, we want to meet patients where they're at. What else is going on in this system? Does it look okay on the cone beam? We look at the meridian chart, this, acupuncture chart that correlates teeth to different organ systems. So those are other things that we're looking at. Some of our patients have muscle testing to determine if there's a lot of bacteria in those teeth, or if that's causing harm or symptoms somewhere else. So those are the main things we look at. I look at the root canal. Does it look good from a clinical standpoint? How long ago did you have this? Like you said, did this tooth come in with an abscess? Did you need antibiotics? That sort of thing. So we really evaluate every single patient individually.
Yeah. Great. That's fantastic. I mean, it sounds like you're very thorough around all of the root canals, and you're using an approach that is keeping in mind what the patient wants and what they're emotionally ready for. Really, they need to be emotionally ready, because you're right. It is a huge undertaking. People are really attached to their teeth in a very different way than other areas of their body. It's fascinating to me. There's something about teeth that it's because it's your smile, your face, it's how you present yourself. It's all part of you in that way. So what about cavitations? Do you ever find that do you see cavitations as being a major root cause for infection as well? Does that come up a lot for you, or can you speak about that?
Yes, absolutely.
I want to start with what a cavitation is. So
yeah, we'll start there. So a cavitation is a site in the jawbone, a non-healing site, typically from an extraction that has potential to harbor a lot of bacteria. It's a place of lack of blood supply. This is something that, again, to reiterate, that we can diagnose only from a cone beam x-ray, unless it's a site that really has a ton of demineralized bone. You wouldn't be able to see it on a pan or traditional x-rays. Patients that come in that tell us, I had my wisdom teeth out, it was terrible, I had dry sockets, it was ongoing, I needed antibiotic. That's a big red flag for there are probably still bacteria in that area. So, so taking out when we remove teeth and when I treat a cavitation, they are very similar, surgical wise. So the goal is to sterilize that bone. We use lasers. Ozone gas is something wonderful and conservative that we have at the office. This is an O3 molecule, and we use it as a gas. We use it in our water every day. And this gets injected into the cavitation site for all that bone. So there is a little bit of the bone removal because we want that fresh blood supply to vascularize that area. So we use ozone to help with that. We also, for any kind of a surgery, we draw blood and we spin it down. We take something called PRF, and that has a lot of growth factors, all of the good stuff. We call it liquid gold, and we pack that back into the socket for quality and quantity of healing, really to ensure that cavitation does not come back.
Great. Wow. You actually heal or fill the cavitation, and does it like seal over almost like cement? I mean, I'm trying to imagine what this kind of looks like.
Yeah, for the PRF, the blood draw.
Yeah.
So it's really kind of like a goopy substance, but it's almost like a mucus plug is what we would call it. And then we pack that back in, and then we suture over it. So our mouths are full of all sorts of bacteria. And we really just want it, as clean of a surgical site as possible.
Wow. Okay. So then you suture over. That makes a lot more sense to me. Okay. Because I could imagine these plugs going kind of falling out after a while.
Great question. I'm just picturing it's something you do every day. And so you suture over it, you keep the site very clean.
Great. Yeah. So I know it's also really important. We find that some people have disease because they are mouth breathers on some level. Like sometimes people, they have such congestion in their sinuses that they end up breathing through their mouth, and they don't even realize that they're doing it or why they're doing it. And so we'll evaluate patients for sleep apnea, let's say, and just looking at breathing patterns and whether or not they have risk for sleep apnea. But then we come to find, oh, you know what, you're mouth breathing, and that's why your mouth is so dry, which then changes the microbiome, which then can set you up for things like cavities and all sorts of issues, right?
Exactly.
Yeah.
So there are,
go ahead.
There are a lot of signs in the mouth that can tell us. Your tongue can tell us so many things. Vitamin deficiencies, scalloping around the tongue can give us, maybe a little clue that you are clenching and grinding at night. Traditionally we thought clenching and grinding, oh, you're just stressed, just, try and relieve stress. But stress, that can be a part of it, but also having lack of oxygen at night. When you clench and grind and tighten those muscles in your mouth, you actually relax the muscles in your airway to allow for more oxygen. Sleep is critical, restful sleep. This is when the body does all of its repair work. So, finding that maybe we need to send a patient for a sleep study or to be evaluated for sleep apnea. This would be a way to get to the root cause of many symptoms that our patients are having.
Right.
It's also, the digestion begins in the mouth as well.
Right.
So, there are a number of things from, salivary enzymes, quality and quantity of saliva, having teeth that are sharp and can actually tear the food and break them down properly. Those are all things that, correlate to the gut. Postnasal drip and addressing that, I really feel, and this comes from one of my mentors, Dr. Levy. He's a cardiologist and a lawyer, and he wrote The Toxic Tooth and Hidden Epidemic. So he's one of my favorite resources, discussing root canals and how it correlates to cardiovascular diseases, cancers, etc.
Yeah, there's a very, very strong connection between cardiovascular disease and toxic mouth, so to speak. Yeah.
Exactly.
Yeah.
Exactly. One of his newest, newest books and ideas is that you cannot heal a leaky gut without addressing postnasal drip and the micros from our oral nasal pharyngeal routes. So, if we're seeing leaky gut that we can't get to the bottom of, we'll discuss nebulizing with hydrogen peroxide. We also work very closely with ENTs for them to evaluate the sinuses as well.
Right, right. I spend quite a bit of time looking at the whole nasal passages and trying to clear that as much as possible so that people can sleep at night and breathe with their mouth closed, so that they can reform that microbiome through the mucosa being moist again. And using oral probiotics as well as GI probiotics that's swallowed orally as well. So there's a big connection between the two for sure. So are there certain types of bacteria that you find are connected to certain conditions in the mouth?
Yes, absolutely. So when we have patients come in that are high cardiovascular risk and have, signs of periodontal disease, bone loss, gum inflammation, bleeding, I will request a salivary panel. So it will tell us exactly what microbes we're dealing with. So periodontal disease is not just localized. These bugs are going all over the place. So sometimes we do need to treat it systemically with an antibiotic, with, ozone therapy. And like you said, oral probiotics. We put, during our cleanings, we try and remove all the biofilm, we use ozone, and then we re-inoculate with the good bacteria so they can be recognized and flourish well. It's all about that balance. So yeah, certain bacteria, we want the good ones, the bad ones, cardiovascular disease, some cancers, diabetes, rheumatoid arthritis, Alzheimer's. They can correlate these bacteria to these diseases.
Oh, absolutely. Yeah. So can you comment about toothpaste?
Sure.
Because there's so many toothpastes out there, and we actually use we actually give out as a sample to some of our patients a probiotic activated charcoal type of toothpaste. It's called Hyperbiotics. I don't know if you're familiar with that brand name, but it's something that we've been giving out for some time now, and I don't even know if we're still doing that. Carol would be the person to ask. But it is a toothpaste that I've been using, and I'm curious about if there is a start. Let's say you start having a cavity. Is it something that can be fixed, so to speak, with using probiotics and or certain kinds of toothpastes, as opposed to getting a filling? What are your thoughts on that?
Yeah. Yeah, absolutely. So the way that we practice, so the first many dental, almost all dental disease is chronic. So you don't wake up one day and just have a cavity. You don't wake up one day with bone loss and bleeding gums. So these are things that are ongoing. So really when we meet a patient, we diagnose decay, but we diagnose areas where I see the cavity process beginning. So that demineralization process. So these are sites that you can actually, heal or remineralize a tooth structure to prevent from getting a cavity. So like you said, I like the idea of using a probiotic toothpaste, and then also using a toothpaste that has hydroxyapatite. This is a mineral. It basically does, very similar things, the good things about fluoride, but it's not a neurotoxin. So I would say, there's more so, I would avoid fluoride in the toothpaste. There are very rare instances that I would recommend a fluoride toothpaste. That SLS, there's a lot of hormone disruptors in toothpaste. So just the toothpaste with the least amount of ingredients would be good. One of my favorites is Boca. I like Risewell, and I like Revitin.
Mm-hmm. Yes, Revitin. I think you sell it at the Biomed Center.
We do. Yeah. We have a joke that there's literally nothing in it. You could put it on a cracker if you wanted to. So, but yeah, that's a personal preference if you like mint, anything. But fluoride, I would avoid fluoride. Kind of the same thing with mouth rinse as well, avoiding alcohol. The majority of our oral cavity is soft tissue. So we want to be really gentle with the soft tissue. Stella Life is my all-time favorite mouth rinse brand. I use this before and after all surgeries, give it to patients to take home and just see really nice tissue healing with that. It's a homeopathic rinse.
Great. Yeah. I would love for you to send me all those names so I can include that in the show notes so people know what to order or buy for themselves if they're interested in. It's nice to have these names and what to look for that's, that you approve of. That's fantastic. So what do you think about a situation where somebody has like a ton of mercury in their mouth? That you also see infections and, they have periodontitis and it seems like, gosh, the teeth look really bad. And, I almost wonder sometimes because I'm thinking about my mother-in-law, actually, it's like, just get all your teeth taken out and just get dentures, just why spend thousands of dollars trying to keep this tooth and keep that tooth? What do you think about that?
Yeah. So that's a great question. Some patients do come in the office and they say, just take them all out. I'm sick of dealing with this. I never want to think about my teeth again. Okay. So I caution them and we go through tooth by tooth and we decide, what is the risk or potential that this tooth could cause an issue in the future. I like to keep teeth as much as possible. Reduction in the bite height. So if there are a lot of missing teeth, especially in the posterior, in the back of the mouth, reduction in like losing your teeth can cause resorption of the bone. So your bone will actually kind of start to, we say resorb or there's less bone. This compresses the lymphatics and the vasculature in the bone. So there's a study done, 1 millimeter loss of bone height decreases the blood supply 50% into the brain. So that's why in that same study, decrease in bone height is also, correlated with Alzheimer's or, cognitive disorders. So very important. If we can keep the teeth, we do. If we can keep the bite, again, chewing, so important. First part of digestion as well.
Right. Right. Wow. Wow. That is huge. Huge. So trying to keep at least the back of your teeth, the back teeth. So that makes the question comes to mind. Well, what about the wisdom teeth? It seems like a lot of conventional dentists are so quick to remove wisdom teeth, and even if they're not necessarily impacted or there's no problems with it, it's, you know, it may not necessarily be causing issues, but really quick to remove them. I almost wonder if maybe it's better to keep them if there's no problems, you know? What are your thoughts on that?
Yeah, exactly. You know, we kind of, you know, when I was in high school as well, you just went, everybody went, you got your wisdom teeth out, didn't matter how they looked. So now we're kind of taking a step back because this wisdom teeth removal can be a source of cavitations. So, you know, individual basis, get a cone beam, see if those wisdom teeth are areas of susceptibility with gum disease. There are typically we find a lot of inflammation around wisdom teeth because they're so far back and they're hard for people to clean. But still, go for an evaluation. Don't just blanketly get your kid's wisdom teeth taken out. And it's interesting too with this evolution. I mean, this could be a whole nother topic, but this evolution of the jawbones and our diets and how everything's a little bit smaller. I see a lot of patients come in that only have 2 wisdom teeth that they were born with. So it's evolution right there. It's pretty interesting.
Wow, I did not know that. That's pretty cool. So is there a way to remineralize a cavity that's just started? Yeah, I'm curious.
Sorry, we got off topic there.
Yeah.
Yeah, so cavities, you know, cavities found between the teeth, that's typically where we see a lot of cavities. So flossing would be indicated for a patient like that. So yeah, let's just back up. Where the cavity is would be really important in how I'm directing and what products that I'm directing hygiene. So for example, if there's a cavity between the teeth, we want to floss. We can even coat the floss with some of that hydroxyapatite, that mineralized toothpaste, and floss with that between the teeth. We can make trays for patients and have them just put a little bit of that toothpaste on so it sits and mineralizes. So this is great. This is topically, you know, hygiene is extremely important, but then, you know, internally as well. What is a patient's vitamin D levels? If patients are coming back to me with a lot of decay, you know, it could be a hormonal imbalance. It could be lack of vitamin D with K. K should be administered, you know, should be with vitamin D. It makes sure vitamin D gets absorbed correctly. Those are the 2, you know, biggest things that I recommend for patients.
Great.
Magnesium and vitamin C is also extremely important for oral health.
Right.
So
what about calcium and phosphorus?
So I don't typically recommend those, you know, on their own. That's something that I would work closer with a functional doctor on. But my 4 biggest ones, we call them the Fantastic 4: vitamin D, K, vitamin C, and magnesium.
Right. Right. Yes. I know sometimes I ask these trick questions.
Yeah, because you know, if we have too much calcium, hypercalcemia, that can be a huge issue. And that can happen when patients come and they're saying, oh, I'm just self-administering vitamin D. No, we really need that ideal ratio of 10,000 IUs of vitamin D to 100 micrograms of vitamin K.
Vitamin K, yes. And there's different types of vitamin K, just so people know. And it's really important to get a level because it is a fat soluble vitamin. And you want to make sure that you're not getting toxic on vitamin D. all the fat soluble vitamins are A, D, E, and K. So it's important to make sure you get a vitamin D level to before you start taking vitamin D. You can safely take it, a couple thousand IUs, which is typically what you'll see in vitamins, at least 1,000. But when you're getting above 5,000 IUs, you do have to make sure that you get a test and then retest maybe 3 to 6 months later,
Exactly. And any big surgeries that we're doing on patients, we're testing the vitamin D, because that is very predictable, especially if we're placing implants. It is just very predictable for the quality of the healing for any work that I'll be doing.
Great. Yeah. Because vitamin D regulates your Treg cells. It basically
that too, immunity.
Yes. It's primary for your immune system. So you're basically doing a check of what's the status of the immune system before you do surgery. I wish all surgeons did that. That would be really helpful. Yeah. So yes. It's a great way to get a sense of at least a simple test, to do to get sort of an immune system check on some levels. Yeah. So I don't know if you're able to do this, but I'm curious if you can sort of help people to understand why mouth disease or dental issues are connected to the heart. Can you connect the dots for people? Because I'm sure that's like, what? What's that got to do with the heart? Can you talk about that a little bit?
Sure. So the mouth is a very susceptible place because there are so many different bacteria in the mouth. A tooth and where the gum meets the tooth, this is the easiest way for invasion of bacteria into the body. So yes, we are swallowing lots of bacteria, but our digestive tract is still considered outside of the body. So the way that bacteria can enter is really from this, if there's this lack of this delicate connection and we're seeing bleeding in between gums and teeth, this is how they enter. So this is, at the very minimal level, this is gingivitis. Advanced levels, this is periodontal disease. So when they're taking these plaques and they're sampling them from occluded vessels, the same bacteria that we're finding when I'm testing high levels of perio disease are the same bacteria that are in these occlusions. So the blood that is, in the mouth and, around surrounding the gums is supplying the rest of the body. So for example, there is this really interesting study where a tracer dye was placed in front teeth. And in about 10 minutes, that tracer dye was in the tonsils. So that's one of my favorite studies. That just goes to show you how quickly, the systemic circulation is moving. Right.
Yeah. But why the heart as opposed to other organs? Is there something about the heart that it seems like dental disease, or is there just a spotlight on the heart, and it really does affect every organ? As you mentioned, multiple conditions, can affect the brain and cause autoimmune issues and can affect your joints or muscles. But is there something about the heart, or is there certain bacteria that have a propensity to affect the heart, specifically?
So the perio disease specific bacteria do.
Okay, they're connected. Okay.
Yes.
That's what I wanted to know, if there were specific bacteria. Okay, so there's, and I wouldn't want you to have to rattle off all the names of the different bacteria.
Yeah, I mean, you're really going to test my pronunciation of those.
Like
AA or AF or
Well, there are specific bacteria, and there's lots of research that shows that there's specific bacteria like Prevotella and Fusobacterium and, Klebsiella that are connected to autoimmune issues. And that Epstein-Barr virus is connected to Hashimoto's. We don't know what to do about them yet, even though they're making these connections, but it is, there are, obviously, with, staph and strep are commonly connected to certain tissues as well. So it's, just curious if there's some research that's really looking at specific bacteria that might be contributing to the heart issues that you brought up. Yeah.
Yeah. Yes, absolutely.
Yeah. Well, thank you for, we talked about a lot of things. I don't know. And I'm really glad that you actually brought up flossing, because this would not be a complete discussion without flossing. It is one of the questions that we actually ask our patients about whether or not they floss. So it's almost like, you could brush your teeth in the same way that you wash your hands. And if you didn't wash your hands between your fingers, right?
Exactly. That's a very right.
Yeah.
Flossing, and then I have to include tongue scraping as well. Very important in the morning. If we're getting that white coating on the tongue, that can give us a little insight to possibly candida overgrowth or any sort of gut concerns.
Right. Absolutely. Yep.
And that will help with bad breath as well.
Mm-hmm. Yes, we actually look for that as well. Yeah. So we definitely overlap a lot, in our approach.
Yes.
Great. Yeah. Yeah. So we're definitely on the same page in terms of philosophy and approach. So I really appreciate everything that you've shared with us today, and I know we'll continue our collaboration and helping to get people to get to their root causes. So thank you for coming today.
Yes, thank you so much for having me. I'll talk to you soon.
Yeah, great.